Conditions where preservative is not necessary when viscera can be analyzed within 24 hours. If sample can be kept in a refrigerator or ice box for hair, nails, bones, lungs, or for detect inhaled poisons. General guidelines for preservation and dispatch of viscera: removal of organs during autopsy. After removal of an organ at autopsy, it should never be kept on any surface. A poison from the surface may stick to it. If advanced putrefaction has occurred, thymosin must be taken for analysis. Containers for preservation of the viscera. The containers should be 1 liter capacity. For blood and urine, they should be of 100 ml capacity. They should be made of glass fitted with a glass top. A plain wide-mouthed polythene, plastic or polymer containers should not be used, as volatile poisoning may diffuse through them. Blood is the specimen of choice for detection of poisoning. Urine may be used for a spot or collector's test. There is no protein binding. Urine is especially important if death is delayed. In such death, the poison may be found only in urine. Cleaning before use, they should be cleaned with a sulfuric acid chromate solution. They then rinsed with distilled water and dried. Rubber inserts. There should be no rubber inserts under the caps. Rubber can react with certain poisons, chloroform, phenol. 2 1 liter capacity containers and 300 ml capacity containers are used for one case. In 1 liter capacity container preserves stomach and its contents, intestine and its contents. In 1 liter container preserve liver, kidney. Cut both liver and kidney into small pieces, 0.5 to 1 centimeter thickness, or mix them in a mixer or grinder for better preservation. Preserve blood, urine in 100 ml container separately. In the third 100 ml container, send a sample of preservative sodium chloride to rule out contamination. Ligated stomach should never be sent for analysis. It must always be opened. Okay. Then disadvantages of sending ligature stomach. Mucous membrane would remain unexamined. Gases produced by putrefaction may result in lid of jar being forced off in transit. Level of filling. Only 2/3 of the capacity of the bottle should be filled with the viscera. This would prevent the bursting of bottle if gases of decomposition are formed. Stoppers of bottle should never be well fitted. Cover with a piece of cloth tied by a string or a tape. Sealed as soon as possible to prevent loss of volatile substance and possible contamination by external material. Labeling of bottles. Labels should include the name of the deceased, age, sex, autopsy number, date and place of autopsy, police station, organ it contains. Preservative should be sent separately to exclude the possibility of contamination. Viscera box. All bottles including samples of preservative are then put in a box which is locked, and the lock is sealed under preferably or departmental seal. This is an important step as it maintains the chain of custody. If the box is not sealed or a seal is broken, if there may be allegation of tampering with the evidence, key of box and a sample of seal kept in an envelope and sent separately. Under the heading medical legal report, copy of postmortem report must be sent with the viscera to toxicologist can relate to postmortem finding its own finding. Other information supplied to the laboratory. Pathologist must make available possible information to the toxicologist. This includes history, symptoms, length of illness, medication to which the deceased had access, empty containers, medication found at the scene, any special risk with the samples of such samples being infectious, example anthrax, gas gangrene, hepatitis B, HIV, tetanus, tuberculosis, or if they contain radioactive material. General non-poison. As far as possible, pathology should not ask the toxicologist to look for general unknown poison. Handling over to the investigating officer. Viscera box, postmortem report, envelope containing sample, seal and key are handed over to the investigating officer. After taking a receipt, usually the postmortem report itself, a copy of which is sent by the doctor. The investigating officer delivers the material personally to the forensic science lab. Sometimes forensic scientists will return the viscera boxes saying that they were leaking. The police officer in such cases will return to the doctor and request a resealing. No resealing should be done once the evidence has left doctor's room. Refrigeration. If an investigating officer cannot take viscera immediately for some reason, refrigerate immediately 4 degrees at 4 degrees Celsius to avoid decomposition. When to destroy the viscera? Rarely viscera may be destroyed if they are not collected by the police officer for a period of time. This can be done after getting permission from the magistrate for the same. When the police gives in writing that the case has been solved and they do not need the viscera maybe anymore, toxicology report. When the toxicology report is available, is collected by the investigating officer and brought to the doctor who studies the report and then gives a final opinion regarding the cause of death. Thank you so much.